Good afternoon and welcome to Transforming Chaplaincy's webinar for today, a qualitative analysis of the role, experience, and perspective of spiritual health practitioners in psychedelic assisted therapy. I'm Andrew Andresco, Project Coordinator for Transforming Chaplaincy, and we are delighted you could join us. Some housekeeping instructions off the top. This webinar is being recorded. You are listening in using your computer speaker system by default and are muted. Should you have any technical questions regarding your audio or visual, please type those into the chat box located in the platform's dashboard. You will have the opportunity to submit text questions for our presenter by typing your questions into the questions box of that same control panel. You may send in your questions at any time during the presentation. We will collect these and hope to include them during a Q&A session at the end of today's presentation. With that, I'd like to introduce Csaba Szilágyi, Director of Transforming Chaplaincy. Csaba?
Thank you, Andy. Hello, welcome everyone. I'm glad you are joining us for today's webinar. It is my pleasure to introduce today's presenter, Dr. Caroline Peacock. Caroline is the Director of Spiritual Health for Winship Cancer Institute at Emory University. And she also serves as the Vice Chair for Wellness for the Department of Hematology and Medical Oncology at Emory University School of Medicine. Caroline is a certified educator with ACPE, an ordained Episcopal priest, a licensed clinical social worker, and a certified teacher in cognitive-based compassion training. She has been with Emory since 2013, where she received her training as a spiritual health educator. And prior to that, she worked as a clinical social worker in New York City. In 2023, she earned her Doctor of Ministry degree from Emory University, Candler School of Theology, with research focused on the experience of spiritual health practitioners in psychedelic assisted therapy. And we are fortunate to hear more about her dissertation research and the implications of that research. Caroline is also the co-founder and co-convener of the Psychedelic Care Research Network of Transforming Chaplaincy, and the network was created to convene professional healthcare chaplains and researchers who are engaged or pursuing opportunities in psychedelic-assisted therapies. Caroline, thank you for being here today. Thank you for all your work in this field and collaborations with Transforming Chaplaincy as well. And before we get started, I just want to plug in our next webinar that's coming up on December 5th at 12 p.m. And it's going to be about providing spiritual care to cancer patients in the outpatient context. And I will put the web link in for that in the chat. So with all that, welcome, Caroline, and I'll turn it over to you.
Great, thank you so much, Csaba, and thank you, Andy, for this invitation. I'm delighted to be offering this for Transforming Chaplaincy. As Csaba mentioned, it's a delight to get to be one of the co-conveners of the Transforming Chaplaincy Psychedelic Care Network. And this network has really helped us bring together spiritual care practitioners, chaplains, whatever terminology you like to use, together to explore this topic on a monthly basis. And I'll share a little bit more about that toward the end of my presentation. So what I'm going to do today is I'm going to share with you the results from my study on a qualitative analysis of the role, experience, and perspective of spiritual health practitioners in psychedelic assisted therapy. And I will just jump right in. Okay. So I'd like, throughout this presentation, I'm actually going to have a number of quotes. So I'm going to start off with one right now. One of my favorites. We're starting to explore psychedelics as a kind of medical intervention. But how do we also recognize the spiritual value of these substances, of these medicines, such that it's not just a medical intervention for sick people, but it's a spiritual intervention for well people who are exploring particular spiritual goals? I think having chaplains involved in this work introduces that critical distinction. There is something else at work here. there's something spiritual and emotional going on here as well. And I think just having chaplains involved in the work puts some kind of inherent validity on that approach. So I completed this study as part of the requirements for the Candler School of Theology Doctor of Ministry program at Emory University, and it was an IRB approved study. And my project consultant was Gary Latterman, who's in the School of Religion, and my program director was Dr. Jennifer Ayers, who's in Candler School of Theology. And I had a great deal of support from Emory Spiritual Health, which is where I'm employed as Director of Spiritual Health at Winship Cancer Institute. So some of you, well, I imagine for those of you who are listening, there's a wide range of experience and knowledge relating to psychedelic assisted therapy. So I'm going to start with just some basic information. I'm going to be using this acronym PAT for psychedelic assisted therapy. And I'm going to be using an acronym SHP for spiritual health practitioners. And that is an umbrella term that I'm using for the interviewees who participated in this study. The interviewees themselves defined themselves with a wide variety of terms, including chaplain, guide, therapist, spiritual care practitioner, and facilitator. Those were some of the terms that were used. So why does this topic matter? Psychedelic assisted therapy is a rapidly developing field, particularly because in the coming years, it is likely that the FDA will approve certain medicines, certain substances for treatment of particular conditions. For example, MDMA is close to being approved for treatment of PTSD. There are a number of clinical trials underway exploring use of psilocybin, which is sometimes commonly referred to as magic mushrooms. So psilocybin is being studied in treatment of things like treatment-resistant depression, a variety of different types of anxiety disorders, substance use disorders, and there are hundreds of clinical trials around the globe happening. And many of these clinical trials have very promising results. So it is likely that these substances will be approved for treatment in clinical contexts. And predominantly what is being studied is psychedelic assisted therapy, which is where persons in a clinical context receive the medicine in combination with a therapy or a psychotherapy that goes along with it. And in most cases, these studies are engaging people who are mental health practitioners as the therapists. There are very few instances of chaplains or spiritual care practitioners who are participating as guides or as therapists or as facilitators. However, psychedelic experience often is very full of spiritual related material. Furthermore, spiritual health practitioners have very, very particular skills that are suited for this modality. And so I did this study of interviews, qualitative interviews with spiritual health practitioners about their role, experience in psychedelic assisted therapy, working as guides or therapists, so that I could contribute to the literature. So I could say that chaplains are doing this work so that hopefully that would help to influence the field, and so that there would be more of a place and opportunity for chaplains or spiritual health practitioners to be engaged in this work within clinical context. So in terms of the people that I interviewed for this study, they were required to have had experience working in psychedelic assisted therapy, along with at least one of the following. They had to have at least a unit of CPE, ordination or status as a religious leader, an MDiv or other theological degree, or specific training intending to matters of spirituality in psychedelic work beyond what the general training programs for psychedelic assisted therapy involve. And the reason the inclusion criteria were so broad is because there are very few people who are like chaplains who are doing this work, and I wanted to be able to get as many folks as possible to participate in this study. So I consented 16 people, and 15 were ultimately included in the study. And I chose to focus on legal settings for a couple reasons. I wanted to support this work in similar contexts in the future. And also because this is such a small community of persons who engage, who are working in this field, I did not want my study subjects to be easily identifiable. And if they had only experience in settings that weren't legal, I was concerned that that might put them at risk in that they were, perhaps engaging in some illegal activity. And so that's why for this study, I wanted to focus on legal contexts. That being said, some of the participants did have experience in underground or what is also called community-based contexts, but everyone had some experience in legal contexts as well. So of the 15 participants, the majority of the participants were in their 40s and 50s, and a slight majority of participants were female. By and large, the participants identified as white or Euro-American, and there were 3 who identified as Hispanic or Latinx. In terms of the types of medicines that the participants had experience working with, the largest number of people had experience working with psilocybin, and second largest was with ketamine. People also had some experience with ayahuasca, LSD, MDMA, and cannabis. And in terms of the context where people were providing this care, the majority were in clinical trials contexts. And behind that, there were people who were practicing in retreat or ceremonial contexts. Some of the people that I interviewed were practicing in Canada and some in South America, or in places within the United States where certain substances are legal, because there are some areas where some medicines are legal, some locales, for example. A few people also had experience in private practice and in clinic, and one person had experience in remote or virtual ketamine-assisted therapy. So most people in clinical trials, for example, working with MDMA or psilocybin, and then for the folks who are in private practice or clinic or remote, that was primarily with ketamine, because ketamine is a legal substance. Although ketamine is not considered a classic psychedelic, it has psychedelic properties, or experience is very similar to some other psychedelic medicines, and so it's often included in this kind of umbrella of psychedelic assisted therapy. In the retreat or ceremonial context, people were primarily using substances such as psilocybin and ayahuasca. So the results fell into 3 broad categories, the results of my research. The first category was, what are the contributions that spiritual health practitioners are providing in psychedelic assisted therapy? The second area was exploration of the inner dimension of spiritual health practitioners in psychedelic assisted therapy. And this is important to me as a CPE educator. I really care about the inner life of persons who are engaging in this work, and so I wanted to engage that topic. And then the third category was on spiritual health practitioners' perspectives on the field at large. And so I'm going to jump into the biggest category in terms of the data, and that is the contributions that spiritual health practitioners provide in this work. And these are the findings from my study, that spiritual health practitioners offer many contributions to this work. And some of those contributions look like this: awareness of power dynamics, familiarity with non-ordinary states of consciousness, competency to work with spiritual material, use of generalizable therapeutic repertoire when working in PAT, the capacity to hold space, and playing an important role on the interdisciplinary team. An outlying finding was that spiritual health practitioners are a cost-effective resource when compared to, for example, psychologists or physicians who may also be serving as therapists in this type of work. So now I'm going to engage a number of quotes relating to these findings. So as I mentioned, one of the findings was that SHPs have competency to work with spiritual material. And here's what one person said. They said, I think it's really important to have the chaplaincy skills so that when a client does see God in their session, we're ready for that. But also, if a client sees God in their session, but then very quickly says, but I know I was just seeing something, we're prepared for that too. I think it really takes specific chaplain skills to deal with both of those situations in the moment. Another person talked about how chaplains are able to step outside one's own religious and spiritual views to help a client explore their own. And this is a very specific skill to chaplaincy. Another one of the findings was that spiritual health practitioners carry some awareness of power dynamics. And this person had a head nod to Anton Boysen, the founder of Clinical Pastoral Education. And they said, we journey with, we work through and alongside a particular individual rather than coming in with our own agenda. We are trained to be quiet and to listen and to interact alongside rather than lead, control, guide, change. The value of chaplaincy is of respecting the individual and trying to read the living human document before us. Another area in terms of awareness of power dynamics and sensitivity to power dynamics had to do with sensitivity around touch and allowing participants to have their own bodily autonomy. And this is important in chaplaincy in general, but especially important in psychedelic assisted therapy because the participants who are undergoing this medicine are in extremely vulnerable states. And this person said, always asking for permission, even before any kind of touch, is very important. She said, I really try to empower their personal touch, their personal choice in the moment. So this was a very common finding that several of the participants in the study brought up. In terms of awareness of power dynamics, people also talked about macro concerns of power. This person said, I think chaplaincy has a lot to add when it comes to respecting indigenous religious and spiritual traditions that have been using these medicines for millennia. Chaplains can be the champions not only for access, but also for answering questions about appropriation. That's where a chaplain's cultural competency becomes essential. How do we respect the history of these medicines, where they come from, the cultures they come from? How do we utilize these in a medicinal or spiritual context in a way that is respectful of these things? As you can see, in relation to this area of power dynamics, it's not just about the micro power dynamics between the spiritual health practitioner and the participant or the client or patient, but also this macro awareness of power in terms of the field at large. Another finding of what spiritual health practitioners can bring to this field was that they have comfort with non-ordinary states of consciousness. And this person said, described it like this. Chaplains have expertise in end-of-life matters when issues of death or experience outside of life outside the present moment, experiences of, we might call them spiritual experiences, peak experiences, religious experiences, experiences of altered consciousness, spiritual visitations or visions. And so many people talked about this comfort with non-ordinary states of consciousness. And within a psychedelic experience, it's very common for people to have this non-ordinary state where they're taken into these other dimensions, into these mystical experiences. And spiritual health practitioners have a lot of comfort with that. And I'm going to share a little bit later why it is that why I think spiritual health practitioners have such capacity with that. Another finding was that spiritual health practitioners have generalizable therapeutic skills that other clinical professionals often have, and these are often present throughout preparation, dosing, and integration, which are the phases of psychedelic-assisted therapy. And some of these skills are things like taking a safety assessment or taking a life history review, offering psychoeducation about the treatment process, assisting with coping skills or offering supportive presence, helping with meaning making or life integration. These are things that other clinical professionals might do. And what my study found was that spiritual health practitioners are also engaging in these kinds of practices. Another finding was that spiritual health practitioners have the capacity to hold space. And this person talked about, this was a quote that came out around that theme. I feel like chaplains are trained to hold the unexplainable, the mystery, the weird, the liminality. I really see us as doulas in a lot of ways. Like there are death doulas and birth doulas, but we are almost like psychedelic experience doulas that can just be present with the experience and support without needing to get in there with any concrete tools. Another person said, in terms of what we are doing from a ceremonial perspective, I'm holding a prayer, holding the prayer and the intention for the individual to be able to help them navigate their experience. And that's another example of holding the space. And a final finding in this category of what the contributions are was that spiritual health practitioners fill a needed role on the interdisciplinary team. This person said, chaplains provide a counterbalance to the biomedical approach and also open up the space for some profound and perplexing ideas that may sometimes conflict with some of the underlying assumptions in the biomedical ideology. And this reminds me of my experience working in ICUs, for example, not in psychedelic assisted therapy, but participating in family meetings and how important the role of the spiritual health practitioner is when offering a perspective that is not related to the biomedical concerns that are going on, but helping the medical team see things from another approach or another lens, and that's very important in psychedelic assisted therapy. The second category of findings was this area of exploration of the inner dimension of SHPs in PAT. And I'm just looking at the time so I can keep track. I asked people several different questions about their inner life, their inner experience. And one of the questions I asked was, do you think it is necessary for facilitators to have their own experience with psychedelics in order to be effective in the work? And of the 15 people I interviewed, 11 people said that personal experience with psychedelics is necessary. And 4 people said that similar experience is necessary, but it doesn't have to be psychedelics. And I'd like to read several quotes from this. One person said, I think if you don't have your own direct experience with it, meaning psychedelic medicine, it's very difficult to comprehend the subtlety that you've entered into and how vastly different the realms, the dimensions, the experiences are when on psychedelics compared to normal reality. Another person had a different perspective. They said, I think it's helpful to understand and to have a reference point for accessing expanded states, but I'm not entirely sure that it needs to be through psychedelic medicine. So they were basically saying that it could be through some other modality that a person could have experience with non-ordinary states of consciousness. And just to give you some context, some other examples of how a person might access expanded states or non-ordinary states of consciousness, that could happen through meditation, it could happen through worship, through prayer, through wilderness retreats, through breath work. There are many other modalities that a person might use to access a non-ordinary state of consciousness. This is one of my favorite quotes from the whole study. This person said, some people experience that awareness, and that's that non-ordinary state of consciousness, spontaneously. People like Abraham Maslow never took a psychedelic. He was a natural Jewish mystic who created the term peak experience and could lie down in his backyard and the heavens would open up for him. I would hire a Maslow anytime, even though he hadn't taken the psychedelic. A footnote here, there are people who have dropped acid 200 times who have not experienced anything really profound psychodynamically or spiritually. So this person was really pointing out that psychedelic experience alone is not enough to make somebody an effective guide. That, you know, and on the flip side, some people have never taken psychedelics and they're very effective. And this other person had another perspective saying, I don't think it's just important for them to have an experience. I think it's important for them to have a relationship with the medicine. And so that's another important perspective that this person had. I also explored this topic of what led people into this work. What was their motivation for their vocation? And several people talked about their own experience with trauma or adversity, and also about healing that they experienced from their own use of psychedelics. And many people talked about their desire to alleviate suffering in others. One person I asked, what led you into this work? And their answer was, well, in one word, pain. And they described their experience of having worked in a domestic violence shelter for a long time and as a chaplain, and having had, you know, a good awareness of trauma, but they experienced an accident and it was taking them a long period of time to recover from their accident, and they were receiving physical therapy. And one day their physical therapist said, you know, I really think something else is going on here besides just your physical pain. And they invited, the physical therapist suggested that having a psychedelic healing process might be of use to this chaplain. And so they went and had their own psychedelic experience, and they experienced such profound healing from that experience that it led them on a path of healing, and they ended up moving into this work, you know, as their full-time work in terms of being a psychedelic therapist for their primary vocation. The final category is this area of spiritual health practitioners' perspectives on the field of PAT at large. And I explored several different topics in this broad category, such as perceptions of positive and negative experience with psychedelics, what the ethical concerns are, how we can learn from communities that utilize psychedelics ceremonially, and what the needs are for the emerging field. When I asked people about perception of positive and negative spiritual outcomes, people shared a number of items, such as that people experience relief from suffering through psychedelics. They experience spiritual joy and growth. They may have a unitive experience or experience self-love or self-compassion. People also talked about negative experience, such as having pain because of unsafe dosing or an unsupported context as a negative experience, or not having enough integration support. It is important to note that this question was not asking people about psychedelic experience in clinical trials, but in general, what are the positive and negative spiritual outcomes of psychedelics? This person, when I asked about negative experience, they said, well, you're getting really theological, because what is negative? If we go to the dark side of the moon, is that negative? If we're doing a painting and we're painting dark strokes, you know, to give it contrast, is that negative? And they said, I think there may well be a deconstruction. I think that you may get faced with some grief when perhaps your Baptist worldview breaks open and your family is startled by it. There can be repercussions and consequences and fallout and challenges that will have to be experienced, and that might bring sadness, and it might propel us into grieving. But none of that is negative to me. It's just the dark side of the moon as we're turning through a holistic, deeper process. And this person talked about negative outcome because of unsafe dosing. And they said psychedelics give us access to realms that we're normally protected from by our psyches, by our brain. If taking too much at once, we lose that protective barrier. We can be exposed in a certain way. You probably know from watching the news, if you watch footage from a war, you're going to be disturbed. But what if you're experiencing all the wars of all the times at the same time? That could have really damaging effects, and we're not designed for that. So this person is really talking about psychedelics more in like a recreational context, not in a clinical trial, because in a clinical trial, there would never be an unsafe dose that would be given. It's a very controlled experience. And this person talked about how negative effects can be just as vast as some of the positive effects, because just like people can have a very strong connective experience, they can also have a very strong kind of deconstructive experience. And they said, like any tool that can cut both ways, it can be a trauma when not held with enough support. And that's why integration support is so important with psychedelics, when people are having that kind of container of support. And I also explored this topic of how can we learn from communities that utilize psychedelics in a ritual or ceremonial context, such as indigenous communities. And this person referenced the work of Shakruna, which is an organization that does a lot of this work. And they said, first and foremost, even before dialogue, is respecting and upholding and being the best ally that I can for indigenous practitioners to safeguard their ways of practice. And further, if there is interest, then collaboration. Finally, I asked about needs of the emerging field, and people talked about things like there should be opportunities to practice in a legal context, that spiritual health practitioners could benefit from having specific training, and that we could benefit from learning from indigenous teaching and elders. Just looking at the time again. So I'm going to go through some of these slides a little more quickly because I want to get to some additional pieces and leave some time for question and answers. Some of the limitations of this study, one of the biggest limitations is that there were limited perspectives of BIPOC persons, and that it was also limited to persons who have offered care in legal contexts. There is a wealth of knowledge and experience from persons who are practicing in community-based settings. And so my hope is that future research might explore how spiritual health practitioners or chaplains are working in those types of contexts in order to gather insights. So some of the takeaways from this study. In terms of the contributions of spiritual health practitioners in PAT, some takeaways are that, you know, all of these findings that spiritual health practitioners contribute to this work through very specific knowledge and skills, through awareness of power dynamics, familiarity with non-ordinary states of consciousness, etc., as I described earlier. And I want to discuss a little bit about why this is. Spiritual health practitioners have training and formation that is different from other disciplines that are engaged in PAT. So, for example, going through CPE, as an example, is very different from getting a degree as a licensed professional counselor or as a clinical social worker, for example. It's just a different type of process. Also, it's common for persons who are chaplains or spiritual health practitioners to have communally based endorsing or ordination processes, so that they're responsible not just to individuals, like not just to an individual client or patient, but to a community at large. And that changes the way that a person understands relationship with power. Spiritual health practitioners have their own experience in non-ordinary states of consciousness through prayer, through meditation, through worship. For many of us, we, in our own formation, we have experience sitting in meditation or prayer for long periods of time. This capacity to be still and to be opening our minds up expansively to whatever may come, this is a different type of training than people who are mental health practitioners or physicians. They don't have that type of training in their processes. So this is really unique, and this is a skill that is very useful in psychedelic assisted therapy. And this capacity to hold space, which is a lot of what chaplains do, this I think we are able to do again through our preparation through prayer and meditation and worship. You know, we learn how to co-create sacred space. And so our training and formation is very different from other disciplines, and it's actually a strength. Additionally, I think our awareness of power dynamics is strong because our organizations such as ACPE and APC have a strong emphasis on justice and non-imposition of care and applied clinical ethics. And because in psychedelic assisted therapy, we're working with very vulnerable participants in vulnerable situations under the medicine, it is so critical to have this non-imposition of care. So awareness of power dynamics is so important. And perhaps most fundamentally, we are trained to work with spiritual material, with nuance, not just based on our own spiritual or religious background. And that is so important because in these experiences, people are going to have a wide range of spiritual material that is coming up, and we will have the capacity to be nimble and to respond to whatever is coming without imposing our particular religious or spiritual perspective on them. So I'm going to, again, move kind of quickly through this. So my recommendations are that there would be more opportunities for training for spiritual health practitioners, and that we would be included in study protocols that are happening, and that certifying organizations that are emerging would include spiritual health practitioners as a category of professionals who are providing the care. And I also think that since this field is emerging, we need humility, and we need to continue to be listening and listening to people who have a tremendous amount of experience, such as Indigenous practitioners, listening to elders who are in the field. So as Chaba mentioned earlier, we do have this Transforming Chaplaincy Psychedelic Care Network. Currently, it's co-convened by myself and Stephen Lewis. And this is our email address at the bottom if you want to reach out to us. And if you go on this Transforming Chaplaincy website, there is where under the list of networks, you can access this Google form. And if you're interested in joining that network, you can fill that out and we will then welcome you into that network. We meet monthly and we explore different topics relating to spiritual care and psychedelics and research. A final quote from the study, and then I'm going to transition to another part of this discussion. This work fundamentally touches on spiritual care, and that is what chaplains are trained in. That is their specialty. There is no way around acknowledging that there are spiritual care dimensions to this work that are inherently involved, despite whether somebody comes from a faith tradition or not. These experiences bring up matters of the spirit, matters of one's relationship with life, with death, with all matters of spiritual dimension of the human experience. So to me, it's just absolutely essential. That was one of my favorite quotes from this study. Before I transition to the next 10 minutes or so of this talk, I want to express gratitude to the spiritual health practitioners who participated in this study and who were willing to talk about their work. This research is currently under review with a journal, and my hope is that in the next few months it will be published. So more to come on that. So as I mentioned at the beginning, I'm associated with Emory, and at Emory we have a department called the Emory Center for Psychedelics and Spirituality. And on this website, there are a number of resources that I encourage you to check out. And we have a number of clinical trials that are underway. And I want to talk to you about one clinical trial that we have to describe a little bit of this work. And this is a clinical trial that I've had the privilege of being involved in. So we are studying the use of psychedelic assisted therapy with chronic cancer survivors with moderate to severe demoralization syndrome and chronic pain. And this is a study that's funded by Winship Cancer Institute, and the psilocybin is from the USONA organization. Let's see here. So the structure is that participants in this study, patients in this study, have a one-time dose of 25 milligrams of psilocybin, and they're being cared for by a facilitator dyad, which is a licensed therapist and a spiritual health clinician. And they also have outpatient palliative care support for 98 days. And what is innovative about this study is that it's psychedelic psychotherapy with multidisciplinary palliative care for patients who are not at the end of life but live with chronic physical and emotional debility in relation to demoralization and chronic pain. So I want to talk about who makes up this. We sometimes refer to this as a triad, that there is the care seeker, who is the patient or the study participant, and they're the core member of the treatment team. They collaborate in the decision making, they inform treatment with their own commitments, and their autonomy and safety are prioritized. Then there's the mental health practitioner who has psychotherapeutic training, and they have CERT competency. So what I mean by CERT is spiritual, existential, religious, and theological competency. And I'm going to reference a paper that might be helpful around that in a little bit. And then the other part of this triad is the spiritual health clinician or the chaplain. And we are trained to respond specifically to CERT relevant distress. We have a distinct approach to autonomy and non-imposition of care. We're experienced with interdisciplinary medical teams. We have 3 years post-master's clinical experience, 1,600 hours in clinical training and residency, and then board certification. And we have spiritual health practitioners because people are having these mystical type experiences that characterize many psilocybin treatment events, and it suggests a potential benefit from the support of persons who are spiritual health practitioners. So I'm gonna, again, just looking at time because I want to leave time for questions. So I'm just going to go quickly here. That this is a slide that takes a look at the structure of the study. So as you can see, we start off with screening the participant. There's a tapering period if they have any current medicines that they're on that are not going to work in conjunction with the psilocybin. Then with the spiritual health practitioner and the mental health practitioner, we work together, and we have 3 preparation sessions with the study participant. Then we have the psilocybin dosing day, and then we have 3 integration sessions. And then after that, there's some post-treatment visits with the palliative care team. This is a picture of our study room. As you can see, there's the 2 chairs in there for the therapist. That is the mental health practitioner and the spiritual health clinician, and the bed for the study participant. They are listening often to headphones, and they have an eye mask on as they're listening to the music, and they're encouraged to go inward into their psychedelic experience. And this is just another picture of the triad model, and this is an actual picture of a study experience where you see on the left, actually that's our executive director, George Grant, who was the spiritual health practitioner in this particular a clinical situation, and then on the right, a mental health practitioner, and then the study participant in the middle, and of course we have permission for sharing this. There is a research article that I really would love to share with you guys. It was put out in JAMA Psychiatry this past summer. It's called Spiritual, Existential, Religious, and Theological Elements: The Importance of Integrating CERT components in psychedelic assisted therapies, and it was in JAMA Psychiatry. So I encourage you to look that up. This was produced by folks in the center here at Emory, and it's a really rich topic, and it explicitly promotes the participation of chaplains or spiritual health practitioners in this work. So to have this kind of publication in such a prestigious journal as JAMA Psychiatry promoting spiritual health practitioners in this work is very significant. So I encourage you to check that out. Andy will be sending you guys out this YouTube link to Your Fantastic Mind, which is a Georgia Public Broadcasting episode or TV show. And there's an episode that's all about psychedelics, and you can actually follow that study participant through his journey in this clinical trial, so you can watch the work in action. And it's the only kind of taping of this kind of experience that includes a spiritual health practitioner. So it's very, very unique. So I've spoken a lot. I want to leave time for questions. So I'm going to stop sharing my screen here so that I can, let's see here, stop screen showing. And I believe Chava is going to, let's see, can you,
Yes.
is my screen is no longer showing, correct?
Yeah, we can see you, but not your slides anymore. Yeah.
Okay.
Yeah. Thank you, Caroline. It just it feels like we have covered a lot of ground, and just you know, I appreciate the nuanced perspectives that you were able to explore with spiritual health practitioners that just further creates evidence to why and how spiritual health practitioners should be integral part of psychedelic assisted therapies. I am looking at the questions. I want to encourage audience to put in questions. We don't have any questions from the audience yet. I may have some questions for you. So in terms of, I'm wondering about your thinking about how chaplains can help move the needle in terms of integrating chaplains in PAT, whether it's used at the institution or not. I think there are maybe two scenarios that we may have chaplains who are aware of this treatment modality at their institution, or people who are interested but they don't necessarily have this available.
Well, this is one of my favorite topics, so I'm so glad you asked. There are many clinical trials that are happening throughout the United States, and they're happening at major medical institutions. And it's not uncommon for there also to be a spiritual care or pastoral care department that exists within the same system. The problem is that these groups are not talking to each other. And so it is it's very common for there to be a lot of misconception between these groups. And so, for example, you may have a psychiatrist or a palliative care, probably not a palliative care doctor, because they tend to be pretty keyed in terms of spiritual care, but you may have some kind of medical practitioner who is not very knowledgeable about the benefits of spiritual care or about chaplaincy in general. And they might not know that, for example, what we do is beyond providing solely religious care. And so you might reach out to them and say, hey, I'm a spiritual care practitioner. I care about psychedelic assisted therapy. There's a lot of work being done on this that is promoting the inclusion of spiritual care practitioners. Here's a paper, you can share with them the JAMA Psychiatry paper that promotes the inclusion of spiritual health practitioners. And you can engage in some advocacy about that role, develop those relationships. Look up in your town if there are any institutions that are doing any studies and see if you might get involved somehow.
And also you mentioned advocacy, like as still an emerging therapy, like all the clinical structures, guidelines, funding, policy is being developed. That's my understanding. And how do you see that level of advocacy for the integration of chaplains?
That's a great question. So, for example, recently the FDA put together a document of clinical guidelines for clinical trials for studies with psychedelics, and the public, and professionals were invited to offer commentary. So the Transforming Chaplaincy Psychedelic Care Network, one of the things we did in terms of advocacy was we put together a letter that we submitted to advocate for the role of spiritual care practitioners. Another thing that folks can do is, if there is, I really love when chaplains, when spiritual care practitioners know that they are people that can engage in research. So anyone who's listening, if you're a chaplain, if you're a spiritual care practitioner, I encourage you, if you're not already engaged in research, to get involved in research. You can write your own IRB study and do a qualitative study, just like I did, of studying chaplains engaged in SHP or in PAT, or you can connect with a palliative care doctor, for example, and co-create a protocol and apply to do a study together. There's so many opportunities that are out there.
Yeah, research, advocacy, informing, and it just, in many ways, it's a new field, as well as some of these themes sound also familiar with how we are trying to integrate chaplaincy in many other clinical settings as well. And as in your study, hearing that chaplains are very well positioned in terms of skills, approach, background to be part of this therapy. What are some of the developments on the training front? I put the links that you mentioned in the web presentation in the chat for people to start reading and accessing the website and the article. But in terms of emerging training, that it draws on our generalist training, and then how to specialize in psychedelic-assisted therapies.
Oh, yes. So I love that you said this sort of generalized training. That is the most essential, that foundation, that CPE, you know, at least 4 units of CPE, then moving towards board certification. And then on top of that, there are trainings that people can engage in. For example, there are a lot of trainings that are developing around the country and world in psychedelic therapies. There's one at Naropa. I went through that one. It was a 10-month training, a certificate program. And I like that one because there was a strong emphasis on matters of equity and inclusion. It was at that time Jamie Beachy, who was one of our founding conveners for this particular network. At the time, she was on faculty there, and so she was one of the people who developed the program, so it was very chaplaincy friendly. But that is a very good program. Also, there's a new program at Berkeley, and they have a very strong emphasis on spiritual care. And so that's another one that people might look into. There's other trainings with CIIS, California Institute of Integral Studies, and others that are out there.
Thank you. And again, that's a advertisement for the research network as well as, and the link is there. So if you're interested in learning more about resources, research, advocacy, training, that's an excellent place to get connected. And I'm just looking at, yes, somebody's asking if the slides will be available. We're gonna post the YouTube video so people can have the slides with the presentation along. So stay tuned for the presentation recording. And I am, with all that, I just wanted to say thank you again, and thank you for doing this pioneering work, you and your team. And it's just really also a model for chaplaincy integration, as I love that picture of the patient in the middle, the clinical triad, and the spiritual health practitioner, mental health practitioner sitting right there together, providing care together in a whole person approach. So thank you again for your work and your research, and look forward to future conversations.
Thank you so much, Chava. Thank you, Andy, and thank you, everyone.
Thanks, Caroline. Thanks, Chava.
Thank you.